The model in layman's terms is made up of a bunch of triangles and shaped like a tree, which isn't accidental. And I think the key thing around the model is that it sort of moves from an external perspective to an internal perspective. So focuses a lot on relationships built on trust and how do you develop those relationships through to knowledge, skills and behaviours, which we call competence. And then beneath that, what leads to those behaviours. So what thoughts and emotions and physical aspects are going on for a person that leads to those behaviours. And then sitting beneath that, what is it in terms of values and beliefs that really drives those thoughts and feelings. So that's a key element of it. And then I guess two other key components are the working environment, so accommodation, information and access to the right equipment, which can constrain or enable capability, and then also the organisational design in terms of structure, job design and policy and process. All of those things go together to what we would describe as a mixture of capacity and competence and confidence, which is the capability that you need at whatever level of a system to meet need. And it's a shift in mindset as much as anything. So people are starting to look at situations with a sort of wider view, considering all those different aspects that impact on capability, and therefore taking a more informed choice about what we need to do. So whether that's where something's gone wrong, or we're trying to work out what the risks and issues are, or whether we're trying to plan for the future. Certainly at an individual level, when I've used it with individuals, I've seen, a growth in confidence. I've seen people come up with a plan of, right, I now know what's getting in my way of doing what I need to do, and I've worked it out, so I'm going to go away and do that. And I think where we're most excited is we're looking to use the model in Wirral and Cheshire West to support the development of care communities. And I think that's really exciting moving forward. That's where we want to focus a lot of our attention. What's important is we're not really just thinking in terms of trust, we're thinking much more in terms of, place or communities, really. So it's about thinking beyond the trust, thinking about what is the contribution, what's the capability that our organisation brings to the wider place, the wider system. And then it's around, well, how can we help build that capability within the wider system, whether that's with the patients, their family and carers, the community or the care providers. And critically, as the starting point, how do we build those relationships based on trust?